Did you know that at least 20% of all police calls for emergency services involve a mental health or substance abuse crisis? In the last 5 years, the Dennis Police Department has received more than 500 calls directly related to mental health. That's why they created a mental health task force.
We were seeing the need we have obviously a super high level of mental health calls and substance use disorder calls, and it was more than the police department could handle in itself. So we needed to branch out and seek professionals in the area.
Those professionals are mental health practitioners and addiction counselors, members of the department's community crisis intervention team, and family services officers who can respond to both an immediate crisis and provide follow-up support.
I work out in the community, and we got lots of calls from the department to come out and help with homeless individuals or people with substance abuse disorders and mental health. It was a lot more than the department could handle at one time. So it made sense to coordinate.
Having my expertise in substance use disorders, I'm able to kind of bring in a wide range of options and perhaps a new perspective in how to approach an individual with a substance use disorder who's come to their attention.
Patrol Officer Brandon Whiting is also a member of the Mental Health Task Force. He says follow-up calls after an incident allow the task force to address the additional ways they can help people.
Like today I'm going out in this uniform, and the point is to be less intimidating and less people I think view us as like law enforcers and you're in trouble as soon as we get there, but the point of this program is to offer help. And so to come out and, we're humans too, and to sort of show that empathy and compassion.
And so far, the task force is already making a big impact on the community.
It's been great so far. I would say like 90% of the people are very receptive and love to see that we're out there and trying to help.
One person actually today I've been working with, he was homeless in a camp in Dennis. We were able to go out and put him up in a motel, provide him services through VinFen's homeless outreach team, got him into a detox this morning, but it all started through outreach through the Dennis Police Department.
Funding for the Dennis Police Department's Mental Health Task Force came from a grant from the Massachusetts Department of Mental Health. Similar funding, as advocated for by State Senator Julian Cyr and State Representative Kip Diggs, has now been allocated to police departments in Barnstable and Yarmouth.
And so what we were able to do in the American Rescue Plan funding proposal that the legislature passed and the governor signed into law was appropriate $120,000 to a program within Barnstable and Yarmouth. So $60,000 a piece to each of the police departments, so they can begin to bring on a mental health clinician to help with co-response.
But co-response is more than just a way to help police address mental health issues in the community. It also helps reduce the stigma of asking for help.
There is a stigma around substance use disorder and mental health, and I feel like we are addressing that head on here at the police department.
In South Dennis, for Cape Media News, I'm Gabrielle Rosson.